Hi everybody, welcome to Health Wanted, the place to be for healthy living. Today we are going to discuss the causes, symptoms, and treatment of gastroenteritis. Even though it's usually uncomfortable and occasionally severe, especially in populations that are more vulnerable, knowing its causes, symptoms, and available treatments is essential. This knowledge can help manage and even prevent its effects. This video examines the main features of gastroenteritis, providing information on how to diagnose it and how to treat it. It also covers prevention strategies and considerations for various at-risk groups. Often called the stomach flu, gastroenteritis is an inflammation of the intestines and stomach that usually causes a mix of vomiting, diarrhea, and abdominal pain. Millions of people worldwide are affected by this widespread ailment each year. However, young children, the elderly, and those with weakened immune systems are more susceptible to severe symptoms. Causes of gastroenteritis. Infection by bacteria, viruses, or parasites is the main cause of gastroenteritis. The most frequent offenders are viruses, with rotavirus and norovirus being the most prevalent ones. Norovirus outbreaks are notorious for spreading quickly and are frequently observed in crowded settings like cruise ships, nursing homes, and schools. On the other hand, rotavirus is a major global cause of severe diarrhea in newborns and young children. In several nations, vaccination has significantly decreased the rotavirus incidence. Foodborne infections like Salmonella, Shigella, Campylobacter, and Escherichia coli, E. coli, are frequently the cause of bacterial gastroenteritis. Outbreaks may result from the contamination of food and water supplies by these microorganisms. Bacterial infections can be more likely when food is handled improperly, such as when meat is undercooked or when fruits and vegetables are not thoroughly cleaned. Bacterial gastroenteritis in impoverished nations is largely caused by inadequate sanitation and a scarcity of clean drinking water. Gastritis can also result from parasitic infections, however they are less frequent. The two parasites Giardia lamblia and Cryptosporidium are usually transmitted by tainted water. These infections can be especially hard to get rid of and may need specialized medical care. Symptoms of gastroenteritis. Depending on the underlying reason and general condition of the patient, gastroenteritis symptoms can change. Typical signs and symptoms include of diarrhea. One of the main symptoms of gastroenteritis is frequent, loose, or watery feces. Vomiting and nausea are frequent and frequently happen suddenly. Cramps and abdominal pain, they can cause anything from minor aches to excruciating pain. Fever, infections caused by bacteria may cause a mild to moderate fever. Dehydration, especially in young children and the elderly, dehydration is a serious concern due to fluid loss from vomiting and diarrhea. Dehydration can include dry mouth, decreased urine production, lightheadedness, and fatigue. Symptoms usually last 1 to 3 days and can appear quickly, especially in cases of viral infections. On the other hand, if left untreated, certain cases, particularly those brought on by germs or parasites, may linger for a week or longer. Diagnosis and treatment. Gastroenteritis is frequently diagnosed by taking into account the patient's medical history and symptoms. Often, further testing is not necessary, particularly if the symptoms are minor and go away quickly. To determine the precise origin of the infection, medical professionals may prescribe stool tests. This is done in more severe situations or when the patient is more likely to experience complications. Although they are rarely required, imaging scans and blood tests might be carried out to rule out other illnesses that mimic gastroenteritis. The main goals of gastroenteritis treatment are symptom relief and avoidance of dehydration. Important elements of the treatment consist of rehydration. It's important to stay hydrated. Particularly for young patients, oral rehydration solutions, ORS, which have a balanced mixture of sugar and salt, are frequently advised. Intravenous, IV, fluids may be required in severe situations. Dietary adjustments. Patients should progressively reintroduce bland foods like rice, bananas, toast, and applesauce once their vomiting has stopped. Steer clear of dairy products, alcohol, caffeine, and fatty or spicy foods to help stop the digestive tract from being any irritated further. Medications, although loperamide, Imodium, an over-the-counter medicine, can help lessen diarrhea, it is best to use it sparingly and only as directed by a healthcare professional. Antiemetic medications can assist in managing nausea and vomiting. Antibiotics are rarely required and are only given when certain bacterial illnesses are identified by laboratory testing. Rest, getting enough sleep speeds up the body's healing process after an infection. Preventing gastroenteritis. There are multiple tactics to prevent gastroenteritis that are intended to lower the chance of infection. Hand hygiene. One of the best strategies to stop the spread of infectious agents is to wash your hands frequently with soap and water, especially before eating and right after using the restroom. Food safety. It's important to handle food properly, which includes cleaning fruits and vegetables, cooking meat thoroughly, and preventing cross-contamination in the kitchen. Bacterial development can also be avoided by making sure food is stored at the proper temperature. Immunization. To prevent severe diarrheal illness in babies, vaccination against the rotavirus is advised. Vaccines are already available. Safe drinking water. It's critical to have access to clean, safe drinking water. Boiling water or utilizing water purification pills can lower the risk of parasite illnesses in places with poor water quality. Avoiding contaminated sources. You can lower your risk of illness by avoiding raw or undercooked seafood, unpasteurized dairy products, and food from street vendors in unsanitary regions. Complications and when to seek medical attention. Although gastroenteritis usually resolves on its own, in certain instances, it might result in severe consequences. The most frequent side effect is dehydration, which can be rather serious in some cases, especially in young children, the elderly, and those with compromised immune systems. Sunken eyes, dry skin, a fast heartbeat, disorientation, and decreased urine production are symptoms of severe dehydration. In the event that these symptoms manifest, prompt medical attention is required. Severe stomach discomfort, a high fever, blood in the stool, and extended diarrhea are some further concerns that may arise. It's critical to get medical attention to rule out more dangerous disorders and obtain the proper treatment if symptoms intensify or last longer than a few days. Apart from dehydration, gastroenteritis can also result in more serious illnesses like hemolytic uremic syndrome, HUS, especially when it's caused by specific strains of Escherichia coli. Kidney failure may arise from HUS, in which case prompt medical attention is necessary. Consequently, it's critical to keep a careful eye on symptoms and to seek medical attention right once if they worsen. Particular attention to vulnerable populations. Severe gastroenteritis and its sequelae are more common in some populations. These include young toddlers and babies, the elderly, expectant mothers, and anyone with compromised immune systems. It is particularly crucial for these people to adopt preventative measures and to visit a doctor right away if gastrointestinal symptoms arise. Young children and infants are more susceptible to dehydration because of their smaller bodies and increased fluid turnover. In addition to making sure kids drink enough water, parents and other adults should watch out for symptoms of dehydration in kids. In addition to being more susceptible to dehydration, elderly people may also have additional underlying medical issues that exacerbate gastroenteritis. Pregnant women should exercise caution as well, as infection and dehydration can be harmful to the developing fetus and the mother. People of all ages can have gastroenteritis, which is a common and frequently uncomfortable sickness. Through being aware of the condition's causes, symptoms, and available treatments, people may control the illness and stop it from spreading. To properly treat gastroenteritis, one must practice good cleanliness, food safety, stay hydrated, and seek medical assistance when needed. Most people can recover from this sickness and resume their regular activities rather quickly if they receive the right care and precautions. People can shield themselves and their family from the most dangerous effects of gastroenteritis by being aware of the risks and understanding how to react. Hand cleaning, making sure food is prepared safely, and keeping up with outbreaks are basic actions that can have a big impact. In the end, attention, early diagnosis, and preventative measures can help lessen the effects of gastroenteritis and enhance general health and well-being. That's all for today. and always remember to stay healthy. Subscribe to the channel to receive regular health tips and advice. Thanks for watching, and we'll see you in the next video.